Over the past few months, following the spread of the novel coronavirus and all of the devastation that has been brought about in its wake, millions of Americans have been robbed of health, of financial security, the certainty of normalcy in their day-to-day lives, and even of their sense of community and connection to others. As it always has in response to our nation's challenges, our voluntary civil society in America, through its courage and compassion, has striven to bring us together to address this very significant, in many ways unprecedented public health crisis. Nonprofits, churches, and other voluntary institutions of civil society have, for centuries, played a uniquely important role in American life, helping to provide for others' basic needs, ensuring the stability of community institutions, and supplying goods such as education and the arts. Key to this spirit is charitable giving. Without financial donations, these organizations simply cannot undertake the good works that they do in providing the indirect benefits, including the provision of these indirect benefits of personal connectedness, reciprocity, and trust that are invaluable and have become indispensable to community thriving and the thriving of the human condition. Unfortunately, there have been worrisome trends in charitable giving over recent years and over the last few decades. As the Joint Economic Committee staff research has found, while total American charitable giving has increased in most years over the last half century, the overall percentage of Americans giving has actually decreased from 66% in 2000 to 56% in 2014, with a particularly pronounced drop among lower-income Americans. Among those at the lower end of the income spectrum, the drop in giving since then has dropped the most. Additionally, the share of individual giving out of total giving has dropped over time, decreasing from 83% in 1978 to 68% in 2018. In other words, giving now comes increasingly from fewer, wealthier people and organizations. So why does that matter? Why should we worry about it? Why are we here today to discuss that? Well, first, it denies communities the necessary positive spillover effects that flow from individual contributions and widespread altruism. And second, the very causes being supported are likely to change as a result of these trends. While higher income Americans tend to give to education and the arts, less affluent Americans tend to give towards service and assistance to the poor. In fact, those making $100,000 or less per year are responsible for almost 49% of all giving in this area of vital need. In other words, even though this segment of the American population might be donating in larger increments, there are a lot of them donating, and a lot of them who have donated historically. And those people are donating in especially valuable areas, and in areas where the absence of the giving might be felt especially strongly, with especially devastating consequences. One contributor to this trend is the federal tax code's inequitable treatment of charitable giving. Because it is below-the-line deduction, only those who itemize, that is to say, generally, tax filers toward the upper end of the income scale, can currently claim the charitable deduction. Lower-income families who don't itemize now receive no incremental additional tax benefit, specifically because of their charitable contributions. That is to say, they don't get anything beyond the standard deduction. This is an unintended consequence of the long-standing bipartisan effort to raise the standard deduction, which itself provides tax relief to lower and middle-income filers, and that's a good thing. But it's an inequality just the same, and it's an injustice to working families and to the local charities who rely on them, especially those charities who do some of the most important work, as we've just mentioned. While the CARES Act, passed earlier this year, did add an above-the-line deduction of $300 for non-itemizers, much more could, and I believe should, be done. I called this hearing to talk about how, especially in this time of immense, unusual hardship, when charitable giving is so essential, Congress could better address this disparity. In recent weeks, I've been part of a bipartisan working group to develop legislation reforming this inequality. I'm grateful that three other members of the group, including Senator Langford and Senator Shaheen and Senator Klobuchar, are willing to be here to talk about it today. Senator Klobuchar is a member of the Joint Economic Committee, and Senator Shaheen and Langford, who are joining us specifically for this hearing today. Especially as we reopen our businesses and our institutions, leveraging charitable giving should be a top priority for those of us tasked with reviewing economic conditions in our country. In the coming months, those of us in the House and the Senate are going to expend a lot of energy trying to figure out which of the federal programs on which we've spent all these trillions of dollars have worked and which haven't worked as well. It's going to be a complicated and at times probably controversial project for all of us. It's necessary nonetheless. With the nonprofit sector, however, the vetting work has already been done for us. Charitable organizations only exist and only attract donations to the extent that they're already believed to succeed. In fact, you can't get donations, and if you get donations once, you can't get them again and again, unless you can present evidence to your donors that you're actually doing something good with it.